want to let us know when everybody's in, because I don't think I can see that.
I think we have everybody now. If anybody comes in, I'll let them in later. Okay. But on our list, that should be everybody.
All right, let's make a start. Hi, everybody. I was going to say good afternoon. I suppose it is good afternoon, everybody. Welcome to our third of the Be Healthy webinars. This one today, we're here to talk about hand washing, which is particularly important in preventing the spread of COVID. I have with me today Joanna, Peasland, a consultant nurse and Deputy Director of Infection Prevention Control from BHealthy. So just before I hand over to her, to Joanna, to talk through all the details about hand washing, I'll just run through a quick little bit of housekeeping and a little bit about the background to the webinar series, so you know where we're coming from. So I think we've covered probably the welcomes, introductions. I probably should introduce myself. I'm Stacey Gunther. I'm one of the service leads in the public health team at Birmingham City Council. If you, throughout the webinar, we welcome questions from you. If you want to type in the chat, we will pick questions up and can pull you in. If you can't access the chat function or are unsure where it is, if you want to unmute your microphone, we'll see you flashing and can bring you in then as well. Okay, thank you. So yeah, just to save our bandwidth, if you can stay muted when you're not talking, and unless you are talking or one of the presenters on the camera during the webinar, that's great, thank you. Importantly, if you think of questions after the webinar, which is always the case, you think of them too late, you can drop us an email at the Healthy Brum email address, which is on the screen now and will be at the end as well. And just so you're all aware, we're recording this webinar as part of our resources that we can use for communities. So everything we're saying is being recorded, okay? Right, moving on to Be Healthy and why we're doing it. So this is a series of resources and webinars that we've developed to help community leaders and professionals who have direct reach to community groups to help them reduce the risk of becoming seriously ill from COVID-19. Alongside the webinars, there's a few resources. So there's a checklist for a healthier you, a getting COVID ready plan, and details on keeping COVID safe. All the materials available to download from our website, and again the web address will be at the end and we'll drop it in the chat as we go for you. These resources are all translated as well, so and available in 20 different languages as well, which should hopefully reach when you're working out with working to reach communities. As I said, we have a series of webinars, and this is the third one. There are 16 in total. We're currently on hand washing, and there's 3 to follow, 3 more COVID safe ones. One about getting your mind ready, and some long-term conditions webinars, and then some around healthy habits that we want to do more of, and unhealthy habits that we like to stop people doing or help them, support them to reduce. It's really important that you get as much out of today as you can. So listen throughout the webinar, think about how you can cascade this to people you work with, and we're really interested to hear your thoughts on that at the end. And yeah, if you want to book any more of the webinars, the link is on the bottom, but we will share it in the chat as well, so you can just click on it. I'm aware that some of you have been to a few so far and are booked onto more, so I will leave it there and I'll hand over to Jo, who's going to take us from there and talk about hand washing. Thank you, Jo.
Thank you. Thank you, everybody. Yeah, like Stacey said, thank you for having me today to talk to you about hand washing, which is one of the most important things. And being in infection control, it's the thing that we talk about probably the most. So today we're just going to look at the importance of hand hygiene. Why is it so important with us, particularly at the moment with COVID? Identify how you can effectively wash your hands and advise other people. And also be aware of how we can minimise risks when we come to talking about hand hygiene. It's important that we understand what our responsibilities are, because we can reduce the risk to others and also to ourselves. So why is hand hygiene so important, and why should we wash our hands? It's the one thing that we can do that helps us prevent the spread of infection. So it protects us and it protects our families. and those people that we're coming into contact with. It means that we're able to do what we can to reduce the risk of infection, and it's the single most important thing that we as individuals can do to help protect ourselves and others. So I just wanted to give you a little bit of background. Oh, I've just lost you all.
I can still see you, Jo.
Okay, I think my screen's, apologies, I think my screen has just locked itself out, so I'll just sign back in.
Don't worry, we keep encountering different like technical glitches every time. So
yeah, I'll have to keep moving my mouse so that I don't lose you again. But what I wanted to talk to you a little bit about now is how germs transfer. So we can have germs and they can be present on our skin, and they can also be present in the environment and on surfaces. And then as we touch things or touch our skin, our hands then can have germs on them. And then we've got the ability to be able to transfer those to other areas. So they can survive on our hands for a prolonged period of time. And then if we miss an opportunity to wash our hands, or if we don't do it very well, our hands can still be contaminated. And then we can transfer that organism or that germ from our hands to another environment or to another person. And as you can see there, it's a vicious circle. So I've put an arrow at the bottom. We can see that if we don't wash our hands and break that chain there, then potentially that's just an ongoing route of transmission and cause of infection to other people. Okay, so I've just got a short video here. One of my colleagues that works at CDC. It's just a 3-minute video to go through the importance of hand hygiene, and then we'll talk about the key points afterwards. Stacey, we can't hear that.
Germs and chemicals
That's
that
it.
every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a cloth nearby, keep scrubbing until you've sung the Happy Birthday song twice. Rinse your hands off under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dryer. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/handwashing.
Okay, so I think there's some really important messages there in that video. There's lots of different products out there now that can help us to wash our hands really well. It's important that we wash our hands with soap and water wherever we can. If they are visibly dirty, that we make sure that we do wash them with soap and water, because alcohol hand rubs won't work on items that are physically dirty. So it is important that we do that. But alcohol hand rubs are very useful when you haven't got the availability of a sink and those other items. It's really important. Some of the key messages from those videos are around when you should wash your hands. So before and after preparing any food or eating or drinking, making sure that we're washing our hands after we've gone to the toilet. Importantly, at the moment with coronavirus, making sure that before you touch your face, that you are washing your hands or using alcohol hand rub. When arriving at places of work or places of worship, and when leaving those areas as well. Importantly, when you get home, and also if you have any episodes of coughing or sneezing as well, you really need to make sure that we're washing our hands at those points. This is just a repeat slide, Stacey, so if we can move on, thank you. So there are people at the moment, as with coronavirus, that are wearing gloves. It's really important that if individuals choose to wear gloves, that we make sure that we let them know that they need to wash their hands. They don't replace the need to wash your hands. So when you've taken your gloves off, you need to make sure that you wash your hands at that point. And that we should only wear gloves when absolutely necessary, because actually gloves can cause risks in the fact that they are like hands. If we don't take them off regularly and wash our hands, then we're just transferring germs from surfaces and potentially can pass on infection to other people in that way as well. So when we talk to people about hand washing, one of the biggest thing that people say to us is they don't have time, and that's the thing that stops them from doing it. So it's really important to remember that washing your hands with soap and water, we need to do it for 20 to 30 seconds. And as mentioned in the video, and you may have seen quite a lot in the media, that could be reciting the happy birthday song twice in your head. It just gives you the right amount of time to do that. Most people, if they're not thinking about it, tend to wash their hands for less than 10 seconds. So it's really important at the moment that we are thinking about that. And if we use the alcohol hand rub, that again, we're rubbing that into our hands for 20 to 30 seconds or until it's completely dry. The areas that are commonly missed when people wash their hands are the areas that you'll see on this diagram in red. So it tends to be people's thumbs that they miss most of all. It's really important that we refer back to those important messages from that video where the demonstration showed that we are washing the backs of our hands, we're washing the fronts of our hands, we're also washing our thumbs and the middle parts of our hands as well. And now it's over to you. If you've got any particular questions, I'm happy to take them from you.
Thank you, Jo. That's so good. The diagrams as well about the bits of your hands you frequently miss. I suspect most of us do, but when we're not thinking about it, definitely.
Yeah, definitely.
Just trying to see if there's any questions at the moment. I don't think there are any coming in at the moment.
Okay, was one of the things that you wanted to mention just around the things that people can do in their own environments? I think the important thing is to try and share these key messages, try and encourage people to wash their hands as often as they can do. If we're in an environment like a place of worship, making sure that we've got alcohol hand rub available when people are coming in and leaving buildings. There are a number of resources that people can use, such as posters, etc., that are available on the government websites, and I think we're going to have some links to those later. That it's really useful to have as displays and reminders. What I would say is it's good to try and rotate those on a regular basis, because people do read things the first time they see them, and then they become a little bit blind to them. So we do always try and just refresh those and have a selection of posters available. And the most important thing that people can do is lead by example. If you're showing other people that you're washing your hands very regularly, they tend to copy you and want to behave in the same way. So if you wash your hands well, other people around you will too.
Thank you, that's great. Let's move on and have a look. Oh, if I can click back on the screen and move on. So these are some of the resources that Jo mentioned. So there's lots and lots of translated resources as well, and posters on hand washing that can be there. Hopefully there's something that's appropriate to wherever you're wanting to use them. If there isn't, let us know and we might be able to help you sort something out. We've pulled them all together and they're all on the Birmingham City Council website at the moment, so they can be downloaded from the link here, which hopefully you can all access, and we will share afterwards as well. So these are here. There's loads of different languages for you to use. Language obviously isn't the only barrier to accessing and reading information. So there's a hand washing video with British Sign Language as well. The link to the YouTube video is available in the handout, and you can see a screenshot from it just to the left of the screen at the moment. Jo's mentioned the using the happy birthday song to wash your hands. There's a link to that as well there. I'm sure we mostly know it, but it's there just in case you need it. And it's a useful watch, or if you've got young people with you, maybe in a school, it's a good thing to use then. And there's also the hand washing wrap that might appeal to some slightly older children in different community groups, so that's there. And then on the next slide, we just have some other resources. So maybe some ways that you can approach talking to children, talking to older people. And we're finding at the moment there's lots of myths and mistruths about information out there. And this is really, really important that we close them down and make sure that the information that's out there is right, and that can most prevent and support our community from catching or spreading infection. And so there's some myth busting stuff there, but if you hear stuff being talked about that you know is not true, just simply say no, that's not, and refer them to this with the correct information in it, and that will help all of us to make sure the correct messaging is out there. So I think we've been trying to do this through the webinar, and I don't think there's too much engagement at the moment. So, and I think Jo's talked about some of the things that we can do to encourage. So making sure that the signposting's up there, that there's posters, that we talk about it, and most importantly, lead by example to make sure we're washing our hands well, especially when we're in places where other people can see us doing it. We should always do it, obviously, but make sure that we can be a role model when we're around people as well. But yeah, I think she says she's clicked in the chat box again. Oh, I think that's all there is on hand washing. Jo, have you got anything else you'd like to add for everybody?
No, just thank you for having me, and I'm more than happy to take any additional questions. If anything comes through, please contact me. I'm happy to answer any questions.
Thank you, that's lovely. We will do. It's always the case that people think of things afterwards or don't want to ask live. So yeah, no, that's really helpful. Thank you. The last thing we have on the screen now is your Be Healthy pledge. We're trying to reach as many community groups and different organisations as possible with this messaging. So what we're asking people to do is to get back to us with how they're going to spread the Be Healthy messaging, and that includes the hand washing and all the other messages we've got out there. But importantly, let us know which community groups you're going to reach. If there's a gap in those community groups that we can see are going to be reached through people that have attended the webinars, we'll look to fill those gaps because we'd like to reach as many people as possible. And lastly, with hand washing or anything else that we're covering in the series, if there is anything else you need to help you reach the community groups that you want to, or any information that you'd like clarifying for yourself, please come back to us. You can drop us an email at the Healthy Brum email address, which is at the bottom there. We're also on Facebook, Twitter and Instagram, and we have our YouTube site as well, where all of the webinars will be held. I think that's all from today. So yeah, we'll pop, following this webinar, we'll send out an email to everybody with more information. So it will show you where all the Be Healthy handouts can be found, and the full list of webinars. It'll also have a link to today's recording and ask you for a bit of feedback as well. So I think that's all from myself and Jo today. Thank you very much for joining us today, and we hope you have a lovely rest of the day. Thank you, everybody. Bye bye.
Thank you.
Ibrahim, do you want to stop the record but don't shut the call?